So I'm a palliative care physician, and so I'm often sort of called in to help clinicians when they are working with patients who they feel are often expressing maybe what they would call unrealistic hope. And I guess what I say to them often is that there's no such thing as an unrealistic hope, in that a hope isn't tied necessarily to any specific reality. And so when a patient hopes for something, there's no reason that we can't hope along with them. A patient will hope for a cure. We may believe, knowing all that we know, that a cure isn't possible, but it doesn't mean that we can't support them in their hope that is possible. I think the counterpoint is that we also have to share with them our realistic worries based on our experience about what may be ahead. I often talk about the purpose of prognostication, which is like knowing, trying to predict how much time someone might have left or what time might be like, around which hope is often connected. And the point of prognostication isn't to be right. The point of prognostication is to help someone prepare in the event that their hopes don't come true. And so I think that there's not only that element of being okay with hoping with a patient, it's also understanding that hope isn't a unidimensional thing, and that people can hope for many things, and that we know that as people learn as their illness progresses, we know that people's hope changes and they start to hope for things other than a cure. And I think one of our responsibilities as clinicians is to try to understand what else they hope for. And because the act of asking about what else they hope for also helps people understand that cure may not be possible.